Hi everyone, my name is Geierstanger. I'm the leader of Plastic Free Gen Z, a San Diego-based youth-led plastic awareness campaign.
And my name is Chen, and I'm the founder of the environmental justice educational campaign Anti-Racist Planet.
Welcome to the Plastic Pollution COP26 countdown with the youth ambassadors of Plastic Pollution Coalition.
Plastic Pollution Coalition is a growing global alliance of more than 1,200 organizations, businesses, and thought leaders in 75 countries working toward a just, equitable world free of plastic pollution and its toxic impact on humans, animals, waterways, the ocean, and the environment.
Today, we have the privilege of interviewing Dr. Shanna Swan. Dr. Swan is one of the world's leading environmental and reproductive epidemiologists. She is a professor of environmental medicine and public health at the Econ School of Medicine at Mount Sinai in New York City. Dr. Swan and her colleagues have been studying the dramatic decline in sperm count and the impact of environmental chemicals on reproductive health for over 20 years. Her book, Countdown, which talks about how the modern world is harming reproductive health, recently came out in February of this year. So we'll begin with our first question. So what exactly drew you to research the impacts of environmental chemicals on reproductive health?
Well, that goes really a long way back. I started my work in the medical health field when I worked on the effects of oral contraceptives on women's health. That wasn't exactly environmental, although it does have environmental implications. But then I started working for the health department, and we investigated the effects of a toxic spill that was solvents from a semiconductor plant, and whether those were related to an excess of miscarriages as a certain community claimed. So it was a very local study in Santa Clara County called the Fairchild Study, and I got really interested in that question. And so I formed a group at the health department called the Reproductive Epidemiology Branch, and started studying the effects of environmental exposures on reproductive health, first women's and later men's.
So you mentioned that environmental chemicals negatively impact human reproductive health. What exactly are these environmental chemicals, and where are they most commonly found?
Well, and I think your friends know who are listening, that there are many, many environmental chemicals. We don't exactly know the number, but when the CDC measures every 2 years the chemicals in our bodies, they measure over 100. So we have to talk about the classes of these chemicals. So a big class are phthalates, and those are the chemicals that make plastic soft and flexible. And they also are in cosmetics and personal care products to hold scent and color. And those are the ones that I've spent most of the time studying, because they all have the ability to lower the body's testosterone. And that's so critical for reproduction, which is an area that I work in. But then there's also the bisphenols. And those are things that make plastic hard, like baby bottles, water bottles. They have other uses, of course, like in receipts and pizza boxes and things like that. But and they are estrogenic as opposed to anti-androgenic, which the phthalates are. And they also affect reproduction. And then there's the pesticides, which is a huge class, and many actions and many kinds of pesticides. I studied several of those, and they certainly impact many aspects of reproductive health. And then there are the chemicals, the flame retardants, the things that are put in products so they're less flammable, in clothing and cushions and wall coverings and floor coverings and everything in your home. And there are many of those flame retardants that affect reproductive function. And finally, I'll just mention the PFAS chemicals. The PFAS chemicals I like to think of them as barrier chemicals. So they put down a barrier, like in Teflon, a barrier between the food and the pan, right? And the fat in the pan. And our water resistant chemicals that make our jackets waterproof, and things that make paper resist oil. And so all of these barriers that go up have endocrine disrupting properties. That is, they can interfere with our body's natural hormones. And we don't want them in our bodies, and we especially don't want them in our bodies when we're pregnant, or for men when they're about to conceive a pregnancy.
Where is the intersection between policy and science related to plastic pollution and its toxic impacts?
So reliable evidence of reproductive risk from these chemicals should govern policy. And that has that's a huge sentence, right? It has a lot of implications. It should govern the testing of chemicals, the regulation of chemicals, and for the most part in the world, that's not done.
So does the toxicity of plastic impact the male and female reproductive systems equally?
You know, that's a great question. And we're not, I don't know about equally, that's hard to say. So many of the impacts, say on fertility, that's a joint impact because it takes the man and the woman. Many of the things like a disruption of the germ cells in utero, that is the cells that will go on to become the sperm and the egg. I would say those are equally important. But the male is much easier to study because it's pretty easy to get a sperm count relative to getting an egg count, which you have to do, through ultrasound. And you can see the quality of the sperm, and you can't really very easily see the quality of the egg. So it's much harder to study the female side. But where we can see this, and some things which are attributed to women miscarriage, although that's actually often a male-driven endpoint, or failure of IVF, which is related to these chemicals, is also male and female driven. So I would say there's a lot of overlap, and probably just like when you say who's responsible for infertility, and you might have heard, men always assume the woman's responsible. That's been historical pose that men have taken. It's her fault. He's fine. And if they can't make it, it's up to her. Well, actually, that's not true. It's about 50-50. And the way that comes out is you can identify male causes in about a third of the cases, identify female causes in a third of the cases, and about a third is shared or unknown. And I'd say that's kind of true of many, many reproductive events where there's an overlap between men and women.
What are the most recent developments in your field of research?
Let's see. First of all, I think the fact that we're paying attention to mixtures is really important and pretty recent. So it used to be that we just studied one chemical at a time, and often that's still done, but fortunately there are many studies that look at many chemicals together. And that's important because these chemicals do interact. And I like to remind people that when they go to a doctor and your doctor is going to prescribe a medication, she probably says to you, what else are you taking? And then you list all the chemicals you're taking. Well, that's because she wants to consider those as possibly interacting with the chemical the medicine she's prescribing, right? So that's kind of happens with chemicals too. So there's been a recent study showing that 15 phthalates and bisphenols at extremely low doses, below the no effect level, when you are exposed to all 15 of them, you have a very significant effect on reproduction. So I think this, looking at the mixtures, and then next most important, I think, is looking at these low doses, like in that study I just cited. So low dose effects and mixture effects are really, really important and relatively new to the field.
Interesting, thank you. We're also wondering what you see as a key leverage point where we can measurably reduce our exposure to chemicals and plastics.
First of all, let me just say, it's really not up to us to reduce our exposure. It should not be up to us. It should not be a consumer responsibility to reduce our exposure, right? Unfortunately, it currently is pretty much our responsibility. And I'd like to point out that we're worse off than the EU. And you probably know that, and that's relevant to, the coming, meetings. But in the EU, there is now 1,132 products that are banned, chemicals that are banned from personal care products. And in the US, it's 11. So if you have to look out for yourself, you have to do it a lot more in this country than in the EU. So you can do that, I think, around foods by, if possible, buying unprocessed foods, buying organic foods, But keep in mind that not everyone can do that. And some people live in a food desert, and some people don't have the money to buy those kinds of foods. And you can do it with your personal care products, but again, that might be limited by your economic situation, because those products that have been tested and found to be safe or safer tend to be more expensive. So not everybody has the same opportunity to alter their exposure.
Another question we have is what sperm count zero actually means.
Well, sperm count zero, actually, you could think of it in two ways. So if a man, an individual, has a zero sperm count, which happens, he has no sperm. It's called azoospermia. It's a medical condition. Okay, obviously he can't get a woman pregnant. But then the term sperm zero has been used in connection with our studies by journalists mostly. So what we showed was a decline in sperm count, which was significant and continuing, and that the place where we were in 2011 was at 47 million sperm per milliliter, down from 99. So a 52% reduction in the sperm concentration, actually 59% in the count. That's huge. In 39 years, 39 years. Think about if obesity increased 59% in 39 years, right? Or IQ dropped 59% in 39 years. I mean, these are very, very big changes. Okay, so when is it going to get to zero, Peter? People ask me. Okay, so an individual can reach zero, but what we plotted was the mean. The mean can't be zero unless everybody was zero, which is highly unlikely. And so what we can do is come close to zero, but never get there. And there's many things in biology that behave like that. So just like we didn't come from a sperm count of 50,000. I mean, it didn't just go up and up and up and up. It can't just go down or down or down. You know, there's limits, there are biological limits. Those are called asymptotes. I don't know if you've heard that term, but those are points that you can approach but never reach. So that's zero sperm.
Dr. Swan, what do you say to people who say that it's good that human population and sperm count is going down because overpopulation is an issue?
That's a common question I get frequently, and it's a difficult question. It's a difficult question. So yes, there are a lot of people in the world right now, but what demographers do and what scientists do is try to think ahead. And if you're at the point where we are now, where many, many populations are not replacing themselves. So there's a lot of people now, but you see that when you look ahead to the next generation, the next two generations, then as the base of the population pyramid, can you imagine that? On top is, you know, there's older people and the bottom is the younger people. Well, it used to be a pyramid. It used to be a lot of young people and very few older people. And that has shifted now so that the base is shrinking and people are living longer. So you're having this very short, you know, very small base, and people at the bottom are not able to support the people at the top. Do you understand? We can't, these few people that are being born now, and that's, by the way, in some countries extremely low. Like in South Korea, it's about one child per woman or couple in the lifetime. That's called the total fertility rate. In Eastern Europe, it's in actually Western Europe as well, it's below 2. In most of Asia, it's way below 2, but we need 2.1 to reproduce ourselves. So as we look ahead, we see that yes, there's a lot of people now, but it's not going to continue. And it's hard for people to understand. The other thing I say to them is, we're not alone on this planet. And if you think this is a good thing that we're having fewer people born, how about all the animals that are threatened and endangered and going extinct? They're also not reproducing, and you can see the cost of that in those populations.
And our last question, what are some feasible commitments that you'd like to see come out of COP26?
I'd like to see a discussion of the role of fossil fuels in the production of plastic, and a recognition that these two conditions, climate change and the reproductive crisis, are intimately linked. I should say the plastic crisis maybe, are intimately linked. And because plastics are made from petroleum byproducts. So they're, as one went up, the other went up. They went together, they're hand in hand, they're sister and brother. And I think people who are now aware of the dangers of climate change haven't made that link to the dangers of plastic pollution. And I think that is one of the things that should come out of that meeting.
Dr. Swan, thank you so much for talking with us today and sharing your work and your perspective. We're honored to have had this opportunity to speak with you, and we look forward to creating a more just and equitable world with you.
It was a pleasure talking to you, and I'm really glad you're working in this area, and I hope you continue, and I'm sure you'll make great contributions to it. Thank you for doing your work.
Thank you.
Thank you.